what were you noticing about physicians and their day that made you feel like they needed an agent?
There's not enough time, Sarah. Anybody who has listened to this podcast has probably said something like this to a friend or a colleague. There's just not enough time in the day. And then on top of that, if we want to get into the reality that our clinicians experience, it turns into not just, hey, you're doing a good job. I need you to be busier. I need you to see more patients. I need you to lead this clinical quality committee. And then on top of that, I need you to do all of your charting and all of that, which ends up getting pushed to when you're sitting at home on your kitchen table for many of the doctors that I work with. And
Mhm.
so to me, there's this pressure for clinicians to do more with fewer and fewer resources, which, if you do the math, that leads to burnout. And nobody's built to do more with less, but that's what we've asked. Think about the last 4 years. Think about the burden we put on the healthcare system, on our clinicians. Have we honored them for that financially or otherwise?
Got it. Okay, interesting. So you are seeing that, well, I guess from your perspective, looking out, looking in at the physicians working, you're not seeing them being adequately reimbursed for the amount of hours that they're putting in as just step one of what you're noticing.
Exactly. That's step one. And usually that stems from a non financial issue, which is you're asking me to see patients way too fast for me to do my job at a high level. I don't have the tools, resources, or supplies to do my job at the highest level. And then on top of that, access issues. I can't even get patients in for 2 weeks, 4 weeks, 6 weeks because of things that are outside of my control as a doctor. And so, to your point, yes, the financial part tends to be a symptom,
Mhm.
but really, where clinicians, I think, are more frustrated, it's on the non-financial pieces of I need, I just want to be a good clinician. I just want to take the best care of my patients. I need the resources, staffing, support, supplies to do that. They're not
Mhm.
asking for a whole lot. And you've probably seen, what do you see? I mean, do your clinicians feel like they have what they need to perform at the top of their license?
I was actually just listening to a podcast on diversity, equity, and inclusion today, and it was really awesome. And if I can find the name of the interviewers inside the podcast, it was fantastic. But they were talking about that piece of even just asking what do you need, and having that insight into how do we help level the playing field here, in that what is it that you need, because each physician and clinician is going to come back to that question with a different answer, and many of them are not saying I need more money. They're actually saying, I want to be I want to be recognized for this work, or I want to be able to see my patients back in a more timely manner, or I want to be able to open a few more appointments in my schedule so that I can get back the critical patients, because right now I will just sacrifice myself and my lunch break or my after work to get them in because they need to be seen. And I'm not going to sacrifice their health because the system won't bend to that.
That is so well put. And it's unfortunate that the business of medicine has gotten to this point where we feel like clinicians are almost ancillary to the healthcare system. They're just cogs in the wheel that if you just plug them in, the healthcare system will run. And that's just not reality. As you mentioned, doctors are, no matter how many family medicine doctors I talk to, I've never talked to two who are identical, who have the same priorities in their practice or same goals for how they provide care. Every doctor is unique and they deserve to be able to provide care at the highest level possible, because who benefits? Patients benefit. Patients benefit from happy doctors, and hospitals and employers know that.
Yeah, yeah.